Well, my name is Gail Rosseau, and I'm a neurosurgeon at George Washington University in Washington, D.C., with an adjunct position as professor of global neurosurgery at the Barrow Neurological Institute in Phoenix, Arizona. As a neurosurgeon, my patients are dealing every day with major, you could call them existential issues. How do I feel about the risk to my sight, my mobility, my hearing, and so forth, so that the potential to discuss these kind of really important issues comes up on nearly a daily basis, and it has for a long time. I've been doing this for a long time. So that first and foremost, being able to address these issues with my patients is important. But increasingly, we're becoming aware that what we represent to patients and to the other members of the healthcare team are an important part of wellness. So being able to feel comfortable in what I represent as a white Christian American woman, that has both potential but also perhaps barriers or things that I don't know and can't see, both for my trainees, my co-workers, the other members of the healthcare team, and even my patients. So I've always thought that there was a strong connection between health and faith, and I think that's even more true today than when I first started in medicine. This story was when I gave my very first talk at an academic neurosurgical meeting. It was way back when we were doing brain biopsies for in patients who are HIV positive to determine what the problem might be that we were seeing on the brains. And when I presented the findings, there was a senior neurosurgeon from the back of the room who protested that we shouldn't be exposing ourselves or our surgical teams to this risk. Now, it was long ago. We knew less about the disease than we do now, but you can imagine I was appalled that he was questioning. I was the junior person in the room, my first attempt to do something that was adding to the medical literature, and the ethics and safety of it was being questioned. And the good news was that the honored guest, who was visiting well-known, globally recognized neurosurgeon from England, said, "Dr. Rosseau, may I take that question?" And he set the record straight for that individual questioner and everyone in the room, and that was that we're doctors first. We take care of people. We don't judge their lifestyle. We don't judge how they got their disease or why they got their disease. We're here to take care of them. And that was such an important lesson for me personally, I think for everyone at that conference as well, to recognize what our role is in the overall health care of people.